checked once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Grammarly helps me get the best grades possible while depleting the least amount of hours of my week. I'm Lauren.
Hello, how can I assist you today?
Hi, doctor. I've noticed some red sores on my son's face, and they seem to be spreading. I'm quite worried about them.
How long has your son had these sores, and where did they first appear?
They appeared about a week ago, starting near his mouth, and now they're spreading towards his nose.
Do these sores burst and form a honey-colored crust?
Yes, they do. Some of them burst and then crust over, while others seem to be just red spots.
How old is your son?
He's 5 years old.
Has he been in close contact with other children with similar sores or symptoms?
Yes, a few kids in his kindergarten class had similar sores.
Does he scratch the affected areas often?
He does, especially when they itch.
Is anyone in your family currently showing similar symptoms?
Not right now, but I'm concerned about it spreading to his younger sister.
I understand your concern. It sounds like your son might have impetigo. Impetigo is a contagious skin infection caused by bacteria, and it's common among young children.
Oh no, is it serious? How can we treat it?
Impetigo is not typically serious, and it's treatable. Topical antibiotics are the primary treatment, but in more widespread cases, oral antibiotics may be prescribed. Ensure your son doesn't scratch the sores and keeps his nails short to prevent further spread.
Should he stay away from school during the treatment?
Yes, it's advisable to keep him away from school until he's been on treatment for at least 24 to 48 hours to prevent spreading it to other children.
What precautions should I take at home?
Regularly wash your hands and your son's hands. Hello, how can I assist you today?
Hi, doctor. I've noticed some red sores on my son's face, and they seem to be spreading. I'm quite worried about them.
How long has your son had these sores, and where did they first appear?
They appeared about a week ago, starting near his mouth, and now they're spreading towards his nose.
Do these sores burst and form a honey-colored crust?
Yes, they do. Some of them burst and then crust over, while others seem to be just red spots.
How old is your son?
He's 5 years old.
Has he been in close contact with other children with similar sores or symptoms?
Yes, a few kids in his kindergarten class had similar sores.
Does he scratch the affected areas often?
He does, especially when they itch.
Is anyone in your family currently showing similar symptoms?
Not right now, but I'm concerned about it spreading to his younger sister.
I understand your concern. It sounds like your son might have impetigo. Impetigo is a contagious skin infection caused by bacteria, and it's common among young children.
Oh no, is it serious? How can we treat it?
Impetigo is not typically serious, and it's treatable. Topical antibiotics are the primary treatment, but in more widespread cases, oral antibiotics may be prescribed. Ensure your son doesn't scratch the sores and keeps his nails short to prevent further spread.
Should he stay away from school during the treatment?
Yes, it's advisable to keep him away from school until he's been on treatment for at least 24 to 48 hours to prevent spreading it to other children.
What precautions should I take at home?
Regularly wash your hands and your son's hands. Ensure he uses his own towels, bed linen, and clothes, and that these are washed frequently. Try to keep him from scratching the sores by keeping his nails short and perhaps using mittens when he sleeps.
You know you are an NRI when your salary slips comes from Dubai, Muscat or Oman. But your suitcase...
Are there any dietary changes we should make?
There's no specific diet for impetigo, but a balanced diet can help boost his immune system. Try to keep him from scratching the sores by keeping his nails short and perhaps using mittens when he sleeps.
Are there any dietary changes we should make?
There's no specific diet for impetigo, but a balanced diet can help boost his immune system. Ensure he's getting plenty of fruits, vegetables, and whole grains.
How long does it typically take to heal?
With treatment, impetigo usually improves within a week. If there's no improvement after 3 to 4 days of starting treatment, please return for a checkup.
Thank you, doctor. I'll start the treatment immediately and ensure we take all precautions.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear.
Good afternoon, doctor.
Good afternoon. How can I assist you today?
For the past week, I've been having this constant urge to urinate, and when I do, it's painful. It also feels like I can't empty my bladder fully.
I'm sorry to hear that. Do you also notice any change in the color or clarity of your urine? Perhaps it's cloudy or has a strong odor?
Yes, doctor. It's a bit cloudy and has a distinct, strong smell.
Have you experienced any fever, chills, or lower abdominal pain?
No fever or chills, but there's a slight discomfort in my lower abdomen.
How old are you?
I'm 45, doctor.
Do you have any history of urinary problems or kidney issues?
Not that I recall. But I did have a bladder infection some years ago.
All right. Do you have any known allergies or current medications you are on?
I'm allergic to penicillin, and I currently take blood pressure medication.
Okay, that's good to know. Based on your symptoms, it sounds like you may have cystitis, which is an inflammation of the bladder, often caused by a bacterial infection. Have you had any recent sexual activity or used any products in the genital area that you haven't used before?
Yes, I had sexual activity recently, and my partner mentioned she had a bit of a UTI a few days prior.
It's possible that this contributed to the onset of your symptoms. UTIs can sometimes be transmitted between partners during intercourse. It's essential for both partners to be aware and treated if necessary to prevent recurrent infections.
I understand. So what's the next step?
Given your symptoms and the potential cause, I'd recommend starting on an antibiotic suitable for UTIs that's not penicillin-based. We may also want to get a urine sample to confirm the diagnosis and determine the best antibiotic.
All right. Anything else I should be doing or avoiding?
Yes. Drink plenty of water to flush out the bacteria, avoid irritants like alcohol and caffeine, and consider taking over-the-counter pain relievers for discomfort. It's also essential to complete the full course of antibiotics, even if you feel better, to ensure the infection is entirely cleared.
I'll follow your advice, doctor. Thanks for your guidance. I understand. So what's the next step?
Given your symptoms and the potential cause, I'd recommend starting on an antibiotic suitable for UTIs that's not penicillin-based. We may also want to get a urine sample to confirm the diagnosis and determine the best antibiotic.
All right. Anything else I should be doing or avoiding?
Yes. Drink plenty of water to flush out the bacteria, avoid irritants like alcohol and caffeine, and consider taking over-the-counter pain relievers for discomfort. It's also essential to complete the full course of antibiotics, even if you feel better, to ensure the infection is entirely cleared.
I'll follow your advice, doctor. Thanks for your guidance.
You're welcome. I hope you feel better soon. Please return if the symptoms persist or worsen, and make sure both you and your partner are treated and free from symptoms to avoid passing it back and forth.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Imagine earning 3,500 dirhams a day. That's 24,000.
Good afternoon, Lisa. I wanted to discuss Mrs. Green's case with you. She was recently diagnosed with type 2 diabetes and is struggling with dietary adjustments.
Ah, yes, I've reviewed her file.
Phew. She was recently diagnosed with type 2 diabetes and is struggling with dietary adjustments.
Ah, yes, I've reviewed her file. It's often overwhelming for patients initially. Did you start her on any medications?
Yes, she's on metformin, but I believe a strong dietary approach can significantly help her control her blood sugar levels. I recommended she see you for a comprehensive meal plan.
Absolutely. We'll go over carbohydrate counting, the importance of fiber, and the timing of her meals in relation to her medication. We'll aim to make it as simple and practical as possible.
Perfect. I'm sure with a collaborative approach, she'll be on the path to better health in no time.
Now look at question 26.
Welcome everyone to today's workshop on integrating sensory integration techniques in everyday therapy. Over the next 4 weeks, we will dive deep into the principles of sensory integration and how it affects both children and adults.
That's right. And this first week, we will explore the different sensory systems, from the tactile system to the vestibular system. Understanding these systems is crucial for recognizing sensory processing challenges.
In our subsequent sessions, we'll delve into assessment tools and therapeutic activities that can be easily integrated into regular therapy sessions. Whether you're working with children on the autism spectrum, adults with sensory processing disorders, or just looking to add more tools to your therapeutic arsenal, this workshop will offer a wealth of information.
We'll also have breakout sessions where you can practice these techniques hands-on with guidance from experts. So get ready for an immersive learning experience.
Now look at question 27.
I had a patient yesterday who is looking to start a vegan diet. She's concerned about getting enough protein and other essential nutrients.
That's a common concern, especially for those transitioning. Did you discuss legumes, tofu, and other vegan protein sources?
Yes, and she's open to trying them, but she's particularly worried about B12 and calcium since she's heard vegans often lack these.
It's a valid point. B12 is primarily found in animal sources. She might need to consider fortified foods or supplements. As for calcium, there are many plant-based sources like almonds, chia seeds, and leafy greens.
Exactly what I told her. I think with proper guidance and monitoring, she can transition smoothly.
Absolutely. It's all about balancing and ensuring she gets what she needs.
Now look at question 28.
I've got a young patient who's showing signs of ADHD. His parents are apprehensive about medication. Do we have non-stimulant options available?
Yes, there are a few non-stimulant ADHD medications. They work differently than stimulants and can be an option for some kids. Atomoxetine and guanfacine are two that come to mind.
I've heard about those and side effects.
Well, like all meds, they come with potential side effects. Atomoxetine can sometimes cause stomach issues, fatigue, or mood changes. Guanfacine might lead to drowsiness, fatigue, or stomach pain, but it varies by individual.
Thanks. I'll discuss these with the parents and see if we want to try them out or look into behavioral therapies first.
Sounds like a plan. Let me know if you need any further information on these or other options.
Now look at question 29.
Good afternoon, everyone. I'd like to start today's seminar by discussing the core principles of patient-centered care. This approach is not just about treating a disease or ailment, it's about treating the entire person. It's vital to remember that each patient is unique with their own backgrounds, experiences, and perspectives.
Exactly. And this requires us to shift our mindset. Instead of seeing ourselves as the sole decision makers, we must view patients as partners in their care. They have invaluable insights about their own bodies and needs.
Right? And when we talk about patient-centered care, it also involves ensuring that care is accessible, equitable, and culturally competent. We need to be aware of potential barriers that might prevent a patient from accessing or benefiting from our care.
Well said. Additionally, effective communication is key. We need to be good listeners, encourage patients to ask questions, and ensure they understand the care plan. With these strategies, we can make healthcare a more collaborative and holistic experience.
Now look at question 30.
How's your shift going so far?
You know, pediatrics always brings its unique set of challenges. Earlier, I had a toddler who was terrified of the stethoscope.
Oh, I've been there. It's heartbreaking and challenging to see young ones scared, especially when we're just trying to help.
Absolutely. It makes me think about how important it is for us to approach our pediatric patients with even more patience and creativity. I ended up showing him how it works on a teddy bear first, and then he was a lot calmer.
That's a great strategy. Sometimes it's these little gestures and efforts that can make all the difference. But on another note, have you attended that workshop on handling pediatric trauma and anxiety?
No, not yet. Is it good?
It's very insightful. I think it'll help a lot, especially with situations like what you experienced today. I'll share the details with you.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work.
Hello, I'm Dr. Eleanor Wallace from the Department of Hematology at University College. Today, we're diving deep into a topic that has touched the lives of many, yet still exists in the shadows of the broader cancer conversation. That topic is lymphoma. Lymphoma is a type of blood cancer that originates in the lymphatic system, the body's network responsible for fighting off infections and diseases. Unlike many other cancers that are named after the organs they affect, lymphomas are characterized by how they affect the lymph. Lymphocytes, a type of white blood cell. Recent statistics from the World Health Organization reveal that in 2018, there were over 500,000 new cases of lymphoma worldwide. This number is startling and emphasizes the importance of awareness, early detection, and effective treatment strategies. There are two main types of lymphoma: Hodgkin's and non-Hodgkin's, with the latter being more prevalent. Both have varying subtypes, making lymphoma a complex cluster of diseases to diagnose and treat. The underlying issue here is the unpredictability of its onset. Many patients have reported nonspecific symptoms like fatigue, night sweats, or unexplained weight loss, which can often be mistaken for less severe conditions. A 2016 study from the National Cancer Institute found that, on average, patients visited their primary care doctors 4 times before being referred to a specialist for a lymphoma diagnosis. This delay in that diagnosis can sometimes have grave implications, affecting treatment outcomes and overall patient well-being. So what's causing this silent epidemic?
You know your business better than anyone, right? So why not build an app to run it with Base44?
While the exact cause of lymphoma remains unknown, certain risk factors have been identified, including a weakened immune system, specific infections like the Epstein-Barr virus, and even some genetic factors. But much is still left to be uncovered. The implications of lymphoma stretch beyond just the medical realm. Patients often talk about the emotional and psychological trauma they undergo. A diagnosis like this can alter one's perspective on life, leading to feelings of vulnerability, anxiety, and even depression. We must ensure that patients are provided not just with medical care, but also emotional and psychological support. Efforts in research and development have led to promising advancements in treatment, including targeted therapies, immunotherapies, and even CAR T-cell therapies. But there's a financial aspect to this. These treatments can be costly, and not every patient might have access to them. Ensuring equity in lymphoma care is imperative. Moreover, the healthcare system needs to place greater emphasis on educating the public and primary care providers about the early signs and symptoms of lymphoma. A well-informed populace can lead to early detection, which, as we know, can significantly improve treatment outcomes. In the larger tapestry of the healthcare conversation, lymphoma threads run deep, and yet they are often overlooked. As with any health concern, advocacy, education, research, and support are critical. Lymphoma might be a silent struggle for many, but by shedding light on it, by investing in research, and by fostering a community of support, we can hope to change the narrative. In conclusion, it is our duty as healthcare professionals, researchers, policymakers, and community members to amplify the voices of those affected by lymphoma. And to ensure that their journey from diagnosis to treatment is as smooth and as hopeful as possible.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Good day, everyone. My name is Dr. Christopher Wilson, and I'm a geriatric specialist with a particular focus on cognitive impairments. Today, I want to talk about a condition that affects a significant number of hospitalized older adults, but is frequently misdiagnosed or overlooked: delirium. Delirium, often characterized by sudden confusion, inattention, and sometimes fluctuating consciousness levels, is not just a natural part of aging, as many believe. Instead, it's a serious medical condition that requires immediate attention and can be triggered by various underlying issues, ranging from infections to certain medications, or even dehydration. Let's dispel some myths about delirium. Firstly, it isn't the same as dementia. While both affect cognitive function, delirium comes on suddenly and is usually temporary, while dementia has a gradual onset and is chronic. Moreover, while dementia is often linked to Alzheimer's disease, delirium's causes are much more varied. It's crucial to differentiate between the two to provide appropriate care. Now, some might ask, if a patient becomes confused during a hospital stay, doesn't it just mean they're adjusting to a new environment? Well, while it's true that unfamiliar surroundings can be disorienting for older adults, the sudden onset of confusion is typically indicative of something more significant. Hospital-acquired delirium is a well-documented phenomenon, often related to factors such as infections, surgery, or even the medications prescribed during the hospital stay. Speaking of medications, it's worth noting that many commonly prescribed drugs, such as sedatives or antipsychotics, can lead to delirium in older adults. It's essential always to review medication lists and assess the risks and benefits, especially in this vulnerable population. A topic of keen interest lately is the relationship between delirium and the post-operative period. It's been observed that after major surgeries, particularly cardiac surgeries, some older adults may develop post-operative delirium. This underscores the importance of monitoring cognitive function closely after any surgical procedure and having protocols in place to manage and prevent delirium. So how do we diagnose delirium? It's primarily a clinical diagnosis based on patient history, symptoms, and a thorough physical examination. Tools like the Confusion Assessment Method, CAM, can be invaluable in these situations, but the cornerstone remains a detailed evaluation and the process of elimination. The inevitable question I often get is, can we treat delirium? The answer is multifaceted. While there isn't a magic pill to cure delirium, identifying and addressing the root cause can resolve the symptoms. This might involve adjusting medications, treating infections, or ensuring adequate hydration and nutrition. However, it's not just about treating delirium, but also about prevention. This includes approaches like regular orientation, ensuring a consistent sleep-wake cycle, and even simple measures like ensuring patients have their glasses or hearing aids. To conclude, delirium, while common, is not an inevitable part of aging. With a better understanding and timely interventions, we can manage and even prevent this condition, significantly improving the quality of life for our older adults. include delirium, while common,